During pregnancy, and is showing a greater risk of complications. For more on this, we are joined now by the lead author and research scientist with the Kaiser Permanente Division of Research, Kelly Young-Wolff, and co-author Debbie Ainsley, Regional Medical Director for Kaiser Permanente Northern California's Early Start Prenatal Health Program. Ladies, thank you so much for being here. I have to say, I didn't even know that women used cannabis while pregnant. When I was pregnant, it's not even something I would have even thought of. So maybe that's naive of me, but I'm curious, how common is it? And what led to this study?
Yeah, that's a great question. So we've been studying prenatal cannabis use for nearly a decade now, and we've seen not only an increase in the prevalence of patients who are using cannabis during pregnancy, but also in the frequency with which they're using. So a greater percentage of those who say they're using are now saying they're using every single day.
Wow.
And this is concerning to us, not only because there's been this really remarkable increase in the strength of the products that are being used on the market today, but also because many people have shown that prenatal cannabis use is associated with adverse outcomes for the baby, so things like lower birth weight and preterm birth. But few studies had looked at the health of the moms, and so that's what we were hoping to address, to just give better data so that pregnant patients can make more informed choices.
Okay, let's talk about the data. I want people to know there was more than 300,000 pregnancies that were studied by researchers. You mentioned it was like 8-9 years in terms of the span. What was the impact on patients who were pregnant?
Yeah, so we did, as you said, we studied over 300,000 people who were screened for cannabis during their gestation. And what we found is some significant health concerns in those who reported use of cannabis early in the pregnancy. Those included such things as gestational hypertension, which is development of high blood pressure, preeclampsia, which is a serious disease in pregnancy, higher or lower birth weight or weight gain during the pregnancy than what we would recommend, and placental abruption, which is premature separation of the placenta away from the uterine lining, which can have serious consequences for the pregnant patient and the baby alike.
So did those people have to seek more medical care then during the course of their pregnancy?
Yes, sometimes it can lead to the neonatal things like the earlier birth, the preterm birth, the NICU admission, into the neonatal intensive care unit because of those complications.
What did you guys find out, or what are some of the misconceptions when I think of somebody maybe using cannabis while they're pregnant? Maybe it's a medicinal thing, maybe they're in pain. What are the misconceptions about that, or what are the reasons why women are using cannabis while they're pregnant?
Yeah. So we know that pregnant patients want to have a safe pregnancy, and in fact they're trying to get information about whether or not it's safe to use during pregnancy. Unfortunately, there's just a lot of misconceptions out there. There's a lot of misinformation, and they're really bombarded with data from cannabis retailers and social media telling them misleading messages that cannabis use during pregnancy is safe. And so, I think that is a reason why patients use, and they're believing that it's safe, and really we're hearing from them that they're turning to cannabis as a way to try to self-medicate, like you said, nausea and vomiting in pregnancy, or depression and stress, which are conditions that we have effective medically approved interventions for.
What if somebody is just so used to using it regularly, then they become pregnant and it's hard for them to stop doing that? I mean, if they are pregnant and they say, I'd like to quit, is there something they can do? What advice do you give them?
Yeah, so we do have resources for that. So at Kaiser Permanente, we have a wonderful program known as Early Start. It's a group of mental health professionals who work directly with our OB care team to partner on education and advice for the patients in a non-judgmental manner. So they provide the information that patients need, the support to possibly quit, or the information that they need to make a good decision that they're comfortable with in their own pregnancy. But even if they're not at Kaiser, wherever they go, it's important for them to get empathetic and realistic information. And we encourage patients to be open with their OB care team to make sure that they get that education that they need, but hopefully in a way that's non-judgmental and that doesn't give them, that isn't stigmatized.
Is there any way to know if there's long-term effects on the babies or the children as they grow? Is that part of the study as well, or what are the next steps in the study? Do we know?
Yeah, that's a great question. We have funding from the National Institute on Drug Abuse to study the longer-term health effects for the infants as they grow up. So we're doing studies on that, and we're also going to be studying whether the mode of cannabis administration matters. This is something that pregnant patients are asking us. Does it matter if I smoke or vape or use edibles? And there just haven't been studies on that yet. So now we're screening all of our pregnant patients in Kaiser Permanente, Northern California, not just for whether they use cannabis, but for how they're using it. And we're going to be looking to see whether the risks associated with use depend on how you're consuming it.
Yeah, important work. So basically the takeaway here that the risks are very strong when you're using cannabis while pregnant. So basically don't do it, right?
Right, if possible, but even if you do, even if they cannot quit or don't want to, reducing their use can still have a positive impact on the pregnancy. So we just want to support them where they are and give them the information they need.
Okay, Debbie, Kelly, thanks so much for your time.
Thank you.
Thank you.